I'm Dr. Priya Sharma, and I spent 11 years working as an ICU intensivist at Northwestern Memorial Hospital in Chicago, Illinois. In critical care medicine, you become intimately familiar with death. You learn to recognize when it's approaching, when it's inevitable, and when it's finally arrived. You learn to pronounce it, document it, and help families accept it. But what I witnessed over 48 hours in November 2023 taught me that death isn't always as final as I believed. Sometimes, for reasons medicine cannot explain, the boundary between life and death becomes permeable, and sometimes a patient gets trapped in the space between. Northwestern Memorial is a Level 1 trauma center in downtown Chicago, one of the premier academic medical centers in the Midwest. Our ICU handles the most critically ill patients in the region. Post-surgical complications, massive trauma, severe infections, multi-organ failure. I'd been working there since completing my fellowship in critical care medicine, and I thought I'd seen every variation of how the human body can fail. The case that changed everything began on November 17, 2023, when a 52-year-old man named Thomas Whitaker was transferred to our ICU from a community hospital in suburban Chicago. He'd been admitted there 3 days earlier with what appeared to be severe pneumonia. Despite aggressive treatment with antibiotics and oxygen support, his condition had deteriorated rapidly. By the time he arrived at Northwestern, he was in septic shock, a life-threatening condition where infection overwhelms the body's defenses and causes widespread organ failure. I met Thomas in the ICU at 2:15 a.m. He was intubated, on a ventilator, sedated, and requiring multiple medications to keep his blood pressure high enough to perfuse his organs. His wife, Linda, was in the waiting room clutching a rosary, exhausted and terrified. I approached her briefly. "Mrs. Whitaker, I'm Dr. Sharma. I'll be taking care of your husband tonight. We're going to do everything we can. Is he going to make it? He's very sick, but he's strong, and we have excellent resources here. We'll fight for him." Over the next 6 hours, I worked with my team to stabilize Thomas. We adjusted his ventilator settings, fine-tuned his blood pressure medications, administered broad-spectrum antibiotics, and monitored every parameter we could measure. By 8:00 a.m., he seemed to be responding. His blood pressure was improving. His oxygen levels were better. His lab values showed his organs were starting to recover. At 8:47 a.m., Thomas's heart stopped. It happened suddenly. His cardiac monitor showed normal sinus rhythm one moment, then ventricular fibrillation the next. The monitor alarm screamed. I was at his bedside within seconds. "Start CPR." Jennifer, one of our senior ICU nurses, began chest compressions immediately. We shocked his heart with the defibrillator. Once, twice, 3 times. We administered epinephrine, amiodarone, every medication in our protocol. After 23 minutes of continuous resuscitation, Thomas's heart rhythm remained asystole, a flat line. I checked for a pulse. Nothing. I checked his pupils with my pen light, fixed and dilated. I looked at the monitor showing his end-tidal CO2, 0, no circulation. Time of death, 9:10 a.m., I announced. We stopped CPR. We turned off the alarms. We covered Thomas's body with a sheet. I went to tell Linda that her husband had died. She took the news with shock and grief. I explained that we'd done everything possible. She asked to see him. I said, of course. At 9:47 a.m., 37 minutes after I'd pronounced Thomas Whitaker dead, I heard screaming from his ICU room. I ran, my heart pounding, thinking perhaps Linda had collapsed, or maybe a medical emergency with another patient. But when I burst through the door, Linda was standing at his bedside, pointing at the monitor with a shaking hand. Thomas's cardiac rhythm had returned. Not the chaotic ventricular fibrillation we'd been trying to convert. Normal sinus rhythm. His heart was beating at 72 beats per minute. Strong, regular, impossible. "That's not possible," I whispered, staring at the monitor, convinced it was a malfunction, an artifact, anything but what it appeared to be. Jennifer rushed in behind me, saw the monitor, and froze. "Dr. Sharma, he has a pulse. Blood pressure is 94/58. I pulled back the sheet. Thomas's chest was rising and falling, shallow breaths, but breaths. His pupils, fixed and dilated 37 minutes ago, were now reactive. "Get respiratory up here now. Call cardiology. I need a full workup stat." Over the next hour, we ran every test available. Thomas's heart function appeared normal on echocardiogram. His EKG showed no signs of damage. His blood work indicated his organs were functioning. By all measures, Thomas Whitaker was alive, but I had pronounced him dead. I had confirmed absence of pulse, breathing, and circulation. He had been dead by every clinical definition I knew. At 11:30 a.m., Thomas opened his eyes. "Mr. Whitaker, can you hear me?" I asked. He nodded weakly. His breathing tube prevented speech, but he was conscious and responding appropriately to commands. His neurological function appeared intact. I explained to Linda that I didn't understand what had happened, that her husband had been clinically dead, but had somehow revived spontaneously. She didn't care about the medical impossibility. Her husband was alive. That was all that mattered. I called Dr. Marcus Chen, the chief of cardiology. He examined Thomas, reviewed all the data, and finally said, "Priya, this shouldn't be possible. Spontaneous return of circulation can occur, but not 37 minutes after death, and certainly not with this complete neurological recovery. Should I report this to the medical board? Document everything. But honestly, I don't know what you'd report. Your patient died, then he didn't. Medicine doesn't have a category for that." At 4:22 p.m., Thomas coded again. This time, I watched it happen. I was reviewing his chart when his monitor alarms activated. His rhythm deteriorated from normal to ventricular tachycardia, to ventricular fibrillation, to asystole in 90 seconds. We initiated CPR immediately. I was doing compressions myself, shocked his heart, administered medications. After 15 minutes, he remained in asystole. But this time, I didn't stop. I kept the team doing compressions, because I'd seen what happened before. At the 20-minute mark, Dr. Chen said gently, "Priya, you need to call it. He's gone. Just one more minute." At 23 minutes, Thomas's heart rhythm spontaneously converted to normal sinus rhythm, just like before. Without intervention, his heart simply started beating again. "How is this happening?" Jennifer asked, her voice shaking. I didn't have an answer. Thomas remained stable for the next 6 hours. I extubated him at 8 p.m. The first words he spoke were, "I keep dying, don't I?" I pulled up a chair. "Mr. Whitaker, what do you remember?" "Both times. I remember both times I died." His eyes met mine. I felt my heart stop. I felt myself leaving, floating above the bed. "I could see you doing CPR. I could see Linda crying in the waiting room. But then something pulled me back, like a rubber band snapping. And suddenly, I was back in my body, and my heart was beating again." "Do you remember what pulled you back?" "It felt like I wasn't allowed to leave yet, like something was keeping me here." At 2:37 a.m. on November 18th, Thomas coded a third time. Same pattern, normal rhythm to ventricular fibrillation to a systole. 26 minutes of death. Then, spontaneous revival. By now, word had spread through the hospital. The ICU patient who kept dying and coming back. Even the chaplain came, not knowing whether to pray for recovery or peaceful death. I hadn't left the hospital. I couldn't. Every time Thomas died and revived, I documented everything meticulously. When Thomas regained consciousness after the third episode, I asked him again what he experienced. "It's the same every time," he said. "I feel my heart stop. Then I rise out of my body. I can see everything happening in the room. Then I hear Linda's voice, even though she's not here. She's saying, 'Come back to me,' and then I'm pulled back." Linda hasn't been in the room during any of the arrests. She's been in the waiting room 3 floors down. I know, but I hear her anyway. Every single time, I went to the waiting room and found Linda. She looked exhausted, terrified. I sat down next to her. "Mrs. Whitaker, when Thomas has these episodes, what are you doing?" "Praying. I'm praying constantly. Every time those alarms go off, I pray that he comes back." "Do you say anything specific?" She nodded, tears welling. I say, "Come back to me," over and over. "Come back to me." I felt chills. Thomas was hearing his wife's prayers from 3 floors away, while he was clinically dead. Over the next 24 hours, Thomas coded 4 more times. Episodes 4, 5, 6, and 7. Each episode followed the same pattern. Sudden cardiac arrest, 20 to 30 minutes of death, spontaneous revival. Each time, Thomas described the same experience, floating above his body, watching the resuscitation efforts, hearing Linda's voice calling him back. feeling that inexorable pull back to life. By the 7th episode, at 6:14 p.m. on November 18th, I had a decision to make. The repeated cardiac arrests were taking a toll on Thomas's body. Each revival left him weaker. His heart muscle was showing signs of damage. His kidneys were beginning to fail from the repeated periods without adequate circulation. His liver enzymes were elevated. He was exhausting his physiological reserves, burning through his body's ability to recover. I called Linda into a conference room and explained the situation as honestly as I could. Your husband is dying repeatedly, and each time he's coming back. But the process is damaging his body. Each arrest, each period without circulation, causes cumulative damage. Eventually, even if his heart restarts, his organs won't be able to support life. I need you to understand that continuing aggressive resuscitation may be prolonging his suffering. Are you asking me to let him die? Her voice was steady, but I could see her hands shaking. I'm asking you what Thomas would want. If he could choose, knowing what this process is doing to him, what would he choose? She was quiet for a long moment, staring at her hands, at the rosary woven between her fingers. 28 years we've been married. I know exactly what he'd want. He'd want to fight. He'd want every possible chance. Tom's never given up on anything in his life. He wouldn't want me to give up on him now. Then that's what we'll do. We'll keep fighting for him. Thank you, Dr. Sharma. She reached out and squeezed my hand. Thank you for not giving up. But I also pulled her aside privately, needing to ask the question that had been haunting me since Thomas's first revival. Linda, I need to ask you something. When Thomas codes, when he's clinically dead, he says he hears you telling him to come back. You're not in the room. You're 3 floors away. Do you believe that's possible? I believe love doesn't stop at death, Dr. Sharma. If my voice can reach him wherever he goes, then yes, I believe it. Love is stronger than death. It has to be. I thought about my own parents, immigrants from India who'd raised me with a blend of Hindu spirituality and respect for Western science. My father, a mechanical engineer, had always said that the universe operated on principles we hadn't yet discovered. Priya, he'd tell me, science is just the process of discovering what has always been true. My mother, devout in her Hindu faith, believed that consciousness, the Atman, extended beyond the physical body, that it was eternal and could never truly die. I'd spent my entire medical career dismissing those beliefs as superstition, as comforting mythology that had no place in modern medicine. But watching Thomas die and revive 7 times in 48 hours was forcing me to reconsider everything I thought I knew. At 11:42 p.m. on November 18th, Thomas coded for the 8th time. This time felt different. His heart stopped, but his vital signs deteriorated faster than previous episodes. His oxygen saturation plummeted. His blood pressure dropped to unmeasurable levels. His skin grew cold. 20 minutes passed, then 30, then 40. Priya, he's not coming back this time, Dr. Chen said softly. He'd been helping me with every resuscitation, running the code team while I focused on Thomas's overall care. He looked as exhausted as I felt, just a little longer. He's been down for 40 minutes. Even if he comes back, the damage, I know, but I owe him the chance. At 53 minutes of continuous resuscitation, my team was exhausted. Jennifer's arms were trembling from the compressions. The respiratory therapist had tears in her eyes. Everyone knew this was different. I finally accepted what I'd known was inevitable. Thomas Whitaker had died for the 8th time, but this time, he wasn't coming back. I pronounced his death at 12:35 a.m. November 19th, 2023. I went to tell Linda, but when I entered the waiting room, she already knew. She looked up at me with tears streaming down her face and said, "He's gone, isn't he? Really gone this time?" "Yes, I'm so sorry. We did everything." "I know you did. I felt it." This time, when I called him back, he didn't answer. He's finally at peace. We walked to his room together in silence. Thomas's body lay still, the monitors silent, the machines turned off. Linda held his hand and spoke to him quietly, words I didn't need to hear. private words between a wife and her husband, final goodbyes spoken over a body that had fought death 7 times before finally surrendering. I left them alone and went to my office. I'd been awake for 48 hours, watching a man die 8 times and revive 7 times. I needed to document everything, but I could barely think straight. My hands shook as I tried to type. The words on the screen blurred. At 2:15 a.m., I was typing my clinical notes when my pager went off. ICU. Stat. I ran, thinking we had a new critical admission, my exhausted legs carrying me down familiar hallways on pure adrenaline. Instead, I found the nursing staff gathered around Thomas's room, staring at the monitors in shock, their faces pale with disbelief. His heart was beating again. Normal sinus rhythm, 68 beats per minute. "No," I said, my voice breaking. "No, this isn't possible. He's been dead for over an hour. We pronounced him. We stopped everything." But his chest was rising and falling. His pupils were reactive. His blood pressure was 102/64. He was alive. Linda was standing at his bedside, frozen in shock, her rosary fallen to the floor. "I didn't call him this time," she whispered, her voice filled with wonder and terror. "I let him go. I said goodbye. I told him it was okay to rest. Why did he come back?" Thomas opened his eyes and looked directly at me. His gaze was clear, focused, urgent. "I need to tell you something. That's why I came back. To tell you something important." I approached his bed, my hands shaking, my medical training warring with the impossibility of what I was witnessing. "Mr. Whitaker, you were dead for over an hour. Your brain should have irreversible damage. This shouldn't be possible." "I know, but I went further this time. Beyond the room, beyond the hospital. I saw things, Dr. Sharma. I was shown things." His voice was weak but determined. "I saw your mother." My blood went cold. "My mother? She has cancer, pancreatic. She hasn't told you yet because she doesn't want to worry you, but she's been having abdominal pain for 3 months. Sharp pain, right upper abdomen, worse after eating. She thinks it's just indigestion, but it's not. She needs to get checked immediately, Dr. Sharma. Tomorrow. Not next week, not next month. Tomorrow." My mother lived in California. I'd spoken to her 2 days ago on my drive to work. She'd said she was fine, busy with her volunteer work at the temple, planning a trip to visit me for Thanksgiving. How could you possibly know? I don't know how I know, but wherever I was, beyond death, someone showed me. Maybe so you'd believe me. Maybe so I could do one good thing before I finally leave. I was shown your mother, shown her pain, shown what's growing inside her. Please, Dr. Sharma, have her checked. It's early enough to treat, but only if you act now. Thomas closed his eyes, his face peaceful despite his labored breathing. His heart rate began to slow. This time, it wasn't a sudden arrest. It wasn't the chaotic ventricular fibrillation that had preceded his other deaths. It was a gentle decline, 68 beats per minute, then 64, then 58. His breathing slowed, became shallow, each breath further apart than the last. At 2:47 a.m., Thomas Whitaker died for the 9th and final time. His heart simply stopped, peacefully, without struggle. This time, there was no spontaneous revival, no sudden return to life, no defiance of death. He was gone, and the finality of it filled the room like a presence. I stood at his bedside, numb with exhaustion and confusion and grief. Linda held her husband's hand and whispered, "Thank you for fighting so hard. Thank you for coming back to help Dr. Sharma. You can rest now, my love. I'll be okay." I pronounced his death at 2:52 a.m. This time, it felt final, real, absolute. The difference was palpable. This death was complete in a way the others hadn't been. I called my mother from my office at 3:30 a.m. California time, still 1:30 a.m. for her. She was awake. She'd always been a night owl. "Mom, when's the last time you saw a doctor?" "Priya, Beta, why are you calling at this hour? Is everything okay? Please just answer. When?" I had my annual physical 6 months ago. Everything was fine. Why are you asking? Have you been having any pain? Any symptoms? Anything you haven't told me about? There was a long pause. How did you know? My heart sank. Mom, tell me. It's probably just stress, just indigestion. I've been having some pain, upper abdomen, especially after eating. But I didn't want to worry you. You're so busy with your work, and I know how you worry. Mom, you need to see a gastroenterologist immediately. Tomorrow morning. I'll set up the appointment right now. I'll call Dr. Patel. Remember him? He's in your network. Priya, it's probably nothing. Tomorrow, Mom. Please. For me. I heard her sigh, that familiar sound of a mother indulging a worried daughter. Okay, Beta, if it will make you feel better. 3 days later, my mother underwent imaging that revealed a 2.3 centimeter mass in her pancreatic head. Early stage. Operable. The gastroenterologist, Dr. Patel, called me personally. Priya, I don't know what made you insist your mother come in so urgently, but you saved her life. If she'd waited another few months, this would have been inoperable. She had surgery the following week. The oncologist confirmed clear margins, no lymph node involvement, no metastases. With adjuvant chemotherapy, her prognosis was excellent, 5-year survival rate over 80%. She'd caught it early enough because a dying patient had seen something impossible and come back to tell me. I took a month-long leave of absence after Thomas's death. I needed to process what I'd witnessed. I needed to understand how a man could die 8 times and revive 8 times before finally staying dead. I needed to comprehend how he'd known about my mother's cancer when I didn't, when she hadn't told anyone, when it hadn't even been diagnosed yet. The medical board reviewed Thomas's case extensively. They examined every record, every cardiac strip, every medication administration, every documentation of his repeated deaths and revivals. They interviewed my staff, reviewed our protocols, scrutinized our equipment. Their conclusion was diplomatically vague. Unusual case of repeated spontaneous return of circulation after cardiac arrest. Phenomenon poorly understood. Recommend further study of similar cases should they arise. But privately, the lead investigator told me over coffee in the hospital cafeteria, Dr. Sharma, what you documented shouldn't be medically possible. We have no framework for understanding it. Some of us believe you experienced a series of measurement errors or protocol failures, though we found no evidence of either. Others think you witnessed something that challenges our fundamental understanding of death. Either way, you practiced excellent medicine under impossible circumstances. No physician could have done more. I returned to work after my leave, but everything felt different. Every time a patient coded, every time I pronounced death, I wondered, is this really the end? Or are they just in transition, capable of returning if something calls them back? Do they hear their loved ones? Do they see things we can't imagine? I'd always approached death as a binary state, alive or dead, 1 or 0, present or absent. But Thomas Whitaker had shown me that the boundary might be more fluid than I'd believed, that consciousness might persist in that liminal space, that love might reach across the divide, that death might not be an ending, but a threshold. My mother recovered fully from her surgery and chemotherapy. She calls me every week now, grateful for the extra time she's been given, making the most of every day. She believes Thomas was sent to save her life, that his repeated revivals were Brahma giving him chances to complete an important task before allowing him to merge with the infinite. She's returned to her volunteer work at the temple with renewed purpose, telling everyone about the miracle that saved her daughter's mother. I don't know what I believe anymore. I'm a scientist. I'm trained to trust evidence, data, reproducible results, but I can't reproduce what happened with Thomas Whitaker. I can't explain it with any theory of medicine or physiology I learned in medical school or residency or fellowship. What I do know is this: Thomas Whitaker died 8 times over 48 hours. Each time, except the last, he chose to come back, and on his final return, he brought information that saved my mother's life. Maybe that's all the explanation I need. Maybe some phenomena exist beyond the reach of medical science. Maybe death isn't always an ending. Sometimes it's a permeable boundary that certain people, under certain circumstances, can cross and recross. Maybe love really is stronger than death. I still work in the ICU at Northwestern Memorial. I still pronounce deaths when the time comes. But I've changed how I speak to families about the dying process. I tell them that we don't fully understand the transition from life to death, that consciousness might persist in ways we can't measure, that love might bridge spaces we can't map, that their prayers might reach further than they imagine. Some families find comfort in that ambiguity. Others prefer the certainty of clear medical explanations. I respect both perspectives now in a way I couldn't before Thomas Whitaker. Linda Whitaker visits the hospital occasionally. She brings cookies for the ICU staff and flowers for the room where Thomas died and revived 7 times before finally letting go. Room 714. The nurses have started calling it the miracle room. She tells me that she feels his presence sometimes, especially when she calls out to him in her prayers, that she knows he's at peace now, his task completed, his message delivered. I believe her, because I've learned that the universe is stranger and more generous than I imagined, that the boundaries we draw between life and death, between possible and impossible, between science and faith, might be more arbitrary than absolute. Thomas Whitaker taught me that death isn't always final, that sometimes we get called back, that sometimes we return with messages too important to leave undelivered, that love can reach across the boundaries of death, that the universe might grant us second chances or seventh chances when there's still work to be done, and that sometimes the greatest gift a dying patient can give their doctor is the humility to admit we don't understand everything we witness. I keep a photo on my desk now, my mother and me, taken last month when she visited for Thanksgiving. She's healthy, vibrant, cancer-free. Every time I look at it, I think of Thomas Whitaker, who died 9 times so that my mother could live. That's a miracle I can believe in.